Sudeb Mukherjee, an interventional cardiologist. I am practicing in Kolkata. I am attached to BM Hospital and MRI group of hospitals. What is diabetes? Diabetes mellitus is a heterogeneous group of disorder that is characterized by either insulin deficiency and or insulin resistance. Most of the time, the insulin deficiency or insulin resistance leads to this metabolic syndrome, which ultimately affects almost all the organ of the body and leads to myriad of complications. That includes starting from your eye, that includes retinopathy, that affects the heart, that includes several macrovascular complications, that also affects your kidney, giving rise to several kidney-related complications and also sometimes gangrene of the lower and the upper limbs. Therefore, it is very essential to control your blood sugar to the perfect targeted guideline-based therapy-based approach. At the same time, you need to be treated with other medications to prevent these morbid complications in the near and the remote futures. For that reasons, you have to follow a strict diet that we call a diabetic diet that is comprised of less carbohydrate, but at the same time you have to maintain a proper nutrition so that you might not lose extra weight. Second important thing is that you have to follow a regular aerobic exercise which is of mild to moderate intensity, and based on your cardiovascular status you can go to the high intensity regimen also. That is very much needed to improve the circulation in all the organs of the body and at the same time to prevent some complication that ultimately gives rise to several fatalities in the patients who are suffering from diabetes mellitus. Awareness regarding the hypoglycemia should also be needed in that aspect, because most of the time we have seen that the patients who are receiving injectable insulin therapy are having these complications of very much lowering of their blood sugar level. Therefore, it is also very imperative to control your blood sugar in the perfect window so that we can achieve a normal glycemic status, at the same time not having any hypoglycemic symptoms, and also in the remote future we can prevent complications. Thank you.